Okay, so key activities for quality asthma care by me, Nick Riesenberg. So first off, asthma diagnosis. You want to establish an asthma diagnosis, determine that the symptoms of recurrent airway obstruction are present based on the history and exam. So a history of cough, recurrent wheezing, recurrent difficulty breathing, recurrent chest tightness. Symptoms occur or worsen at night or with exercise, viral infection, exposure to allergens and irritants, changes in weather, hard laughing or crying, stress or other factors. And in all patients, either over or equal to 5 years of age, use spirometry to determine that the airway obstruction is at least partially reversible, and then also consider other causes of the obstruction, especially if they're a young child. Could it be croup or hepatitis? What's causing that airway obstruction there? I mean, that airflow obstruction. So long-term asthma management, the goal is asthma control. You want them to be in control of their asthma, not having to feel out of breath and like they can't catch a breath all the time. So reduce impairment is the first thing. You want to prevent chronic symptoms, require infrequent use of short acting beta-2 agonists or a SABA, and maintain near normal lung function and normal activity levels. And the second thing is you want to reduce their risk. So you want to prevent exacerbations, minimize need for emergency care and hospitalization, prevent loss of lung function, or for children, prevent reduced lung growth because their lungs are still growing at that point, and the more you let that disease control that process, the worse their lungs will be in the future. And then we want to minimize adverse effects to the therapy because if they're using an ICS, like we've talked about, there's things that could be happening with a steroid. You could get thrush and different other side effects. So asthma care for special circumstances. We're going to go over two special circumstances. One is the exercise-induced bronchospasms, or EIB, and then pregnancy. So exercise-induced bronchospasm, or EIB, we want to prevent that. We want physical activity should be encouraged for them. Just because they have exercise-induced asthma doesn't mean they should not exercise. For most patients, EIB should not limit participation in any activity they choose. You just got to be a little bit more careful and a little smarter about it. We want to teach patients to take treatment before exercise. SABAs will prevent an exercise-induced bronchospasm in most patients. LTRAs, or Leukotriene receptor antagonists, or a long-term one. Cromolyn or LABAs also are protective. Frequent or chronic use of a LABA to prevent EIB is discouraged as it may disguise poorly controlled asthma. Consider long-term controlled medication. Exercise-induced bronchospasm often is a marker of inadequate asthma control and responds well to regular anti-inflammatory therapy. And encourage a warm-up period or a mask or scarf over the mouth for cold-induced, exercise-induced bronchospasm. As a child, I think I was 9 or 10, I had a asthma attack from this situation, running around the cold, exercising, and I did not have very well managed asthma, and that definitely showed that night. And I had to go to the emergency room, so that was definitely a experience for me. So I wish I would have known more. I mean, I was a child, I probably didn't care, but I wish my parents were taught more because I know my parents are the kind of people that would take that seriously. But I feel like we talk about a lot, just talking about how to administer medication. I don't think I got that properly, and my asthma wasn't managed properly. So that's one big part of asthma, is being able to manage it properly, and it's our jobs to be able to give that information appropriately to parents and kids, and also just asthma adults, so that they can do that on their own, because the job is in their hands at that point. We can prescribe, but if they're not taking it effectively at the right times and with the right technique, then it won't matter. So other than the exercise-induced bronchospasm, there's pregnancy. Maintain asthma control through pregnancy. So check asthma control at all prenatal visits. Asthma can worsen or improve during pregnancy, so adjust the medications as needed. Treating asthma with medications is safer for the mother and fetus than having poorly controlled asthma. So maintaining lung function is important to ensure oxygen supplies to the fetus. So giving them an ICS or whatever medication has less effect toward the fetus than just having poor lung function from asthma. So that's something we need to have treated. ICS, or the inhaled corticosteroid, are preferred long-term controlled medication, and remind patients to avoid exposure to tobacco smoke, as you should really not need that recommendation or reminder, but people do. Managing exacerbations from home care. So Key clinical activities and action steps for home care is to teach the patients how to recognize early signs and symptoms and peak flow measures that indicate worsening asthma. Adjust medications so you can increase the SABA, or in some cases add an oral systemic corticosteroid, and remove or withdraw from environmental factors contributing to the exacerbation. And then we want to monitor the response, how they're responding to what we've done so far. And then seek medical care if there is serious deterioration or a lack or response to the treatment, give specific instructions on who and when to call. So this is a little setup to tell patients when they're at home how to know if you're getting worse or better without just being like, oh, I'm not breathing well today. If you get to that point, then we're not monitoring it well enough to see that you were progressing in the wrong direction. So this is a way for them to be able to monitor their own the signs and symptoms and keep an eye on themselves. So managing exacerbations in the urgent care or emergency center. So same thing, key clinical activities and action steps, assess severity by lung function measures, and for ages over or 5 or equal to 5 or over, physical examination and sign and symptoms. Excuse me. So assess lung function measures for people 5 and over, and then physical examination and signs and symptoms. Treat to relieve hypoxemia and airflow obstruction, reduce airway inflammation, and then use supplemental oxygen as appropriate to correct hypoxemia. Treat with repetitive or continuous SABA with addition of inhaled ipratropium bromide in severe exacerbations, or a duo. I think we do that quite a bit in emergency care or just in hospital care in general. Give oral systemic corticosteroids in moderate or severe exacerbations for patients who fail to respond promptly and completely to the SABA. And consider adjunctive treatments such as intravenous magnesium, Heliox, and severe exacerbations that have been unresponsive to other forms of treatment. So managing, sorry, trying to move this tile out of the way. Managing exacerbations in emergency care continued here. We want to monitor response with repeat assessment of lung functions and measures and physical examination and signs and symptoms. And in emergency department, pulse oximetry. I mean, we've all been in the ER and everyone's got a pulse ox on. Discharge with medication and patient education. So medications, it's SABA or ICS oral corticosteroid. Consider starting one if they haven't been on already. Referral for follow-up care. We always want to do follow-up care because we want to monitor how you're doing with this asthma and how it progresses. Have an asthma discharge plan. That's like the action plan. What we want to do going forward, what we need for them to do to be monitoring their own symptoms and their own asthma, and review of inhaler technique whenever possible, environmental control measures. A lot of this stuff is just having to prevent what's going on. Make sure you're taking your medication effectively, reviewing that you are taking it the right way, your technique is right, and knowing that you are avoiding any environments that are going to cause you to have an exacerbation.